Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is part 2 of the question and answer video that I started yesterday. These are questions that were in response to one of my previous videos about tests to consider for biohacking your way towards optimal health. And it was about the heavy metal test video in particular. So there's one other question that was asked on that video that I just couldn't get to in the last video. So the test is the heavy metal test. You did mention if done, you would be able to tell if a person has metal in the body within the past few weeks from the test. Are those 2 weeks enough to know if there is metal in the body? So just to clarify around that, I'm not sure exactly what I said in that video. I have gist of what I said, but I may have misspoken. However, with the testing, basically there's 2 parts to the test. There's the baseline urine test, so you just a first morning random urine collection that's done, and then the second test is administered after, or is the second test sample, the second urine sample, is collected after a heavy metal binding agent known as a chelating agent has been administered either intravenously, which is ideal, or orally, which is second best and still good, just not as good as IV. And so those are the 2 parts of the test. So in essence, the baseline test is going to give us insight into the exposures that a patient's had within the previous couple of weeks, give or take. So if I went down to the shooting range, shot a bunch of lead bullets, or if I cracked open a mercury thermometer in my basement and was smelling the fumes of that, then my blood levels and my urine levels would be spiked for blood levels for about a week. Urine levels, I'm not exactly sure how long they stay spiked for, but likely higher than average for at least a couple of weeks. And then they should just go back to baseline, because the body is very smart and says, oh my gosh, these are incredibly toxic naturally occurring substances. We want to get that out of the bloodstream and ideally detoxify as much as possible. But that's hard work. It takes a long time. So it's kind of like if you're a kid, you have to clean your incredibly messy room within like 2 minutes, or else you're going to get in big trouble. You probably can't do a proper clean. You're just going to stuff a lot of stuff under the bed, in the closet, etc. So that's what our bodies essentially need to do when we're inundated with heavy metals. They're going to tuck those metals away in muscle cells and fat cells and other tissues. They're going to get it out of the blood so it can't get to the brain and the eyeballs and other crucial tissues as easily. I mean, they still get there, but the body's going to try to sequester it away to some of the less vital tissues in the body. So that's the reason that the baseline result, just the random first morning urine sample, is reflective of recent exposure, so within the last couple of weeks. Whereas on the other hand, the other test is going to be reflective essentially of your lifetime accumulation of metals. Using that messy room analogy, if you're kind of cleaning your room for 5 minutes a day, but you're spending an hour a day making a bigger mess, like the room could just get messier and messier and messier. So meaning if you're clearing out metals, but not as quickly as you're accumulating more, you're going to bioaccumulate them more and more over time. And generally speaking, this takes, years and years, like decades really, for the levels to build up to an appreciable extent, unless you have really, really compromised detox pathways, in which case, we can see elevated metals in folks that are really far too young to see these elevations. I've seen them in, treat a lot of children on the autistic spectrum. I've run heavy metal panels on many of these pediatric patients, and sometimes it's just mind-boggling to see how high their levels of metals can be. It's like, you haven't been on this earth for long enough to accumulate those. And so if there's compromised enough detox pathways, for example, that could lead to a premature accumulation. So I hope that clears up that question, and I think that covers that part of it. So I will leave it there. If there's any other questions on this topic or anything else, you feel free to post them in the comment section below. Otherwise, I will post another video again soon.